really the solution that FemSelect has, it's called InPlace, as you mentioned. It is a minimally invasive approach to a pelvic organ prolapse procedure. And I know a lot of procedures are talked about as minimally invasive, but I think the interesting part is the procedures in prolapse split between vaginal procedures and then, laparoscopic or even much more invasive procedures, like a hysterectomy. If you ask me, vaginal procedures are much less invasive than a laparoscopic or a robotic or a hysterectomy. But even a vaginal procedure has a lot of cutting involved. I like to make it very simple. We could say dissection, which is the fancy word for cutting, but it can be a very invasive procedure for a woman. And when we have an invasive procedure, it can have a long recovery time, can be a long surgery under general anesthesia, potential for some complications. And, what the founders of FemSelect came up with was a solution really to pierce the vaginal skin with a very tiny implant. And I say it because piercing an ear sounds like so easy, right? You just, take something very small and tiny and use a tool to get it in. And that's basically what we do is we have a tool that helps a physician take this very tiny little implant and pierce the vaginal wall to get this anchor into the ligament.